Hey guys, my name's Sam and welcome to Paramedics. In this week's video, we are covering what EMS is doing to protect ourselves and our patients from the coronavirus. Now, I'm going to preface this entire video by saying that we really don't know a lot about this yet. So our department has implemented a lot of things that follow the CDC guidelines. We've taken that one step further in some instances, but in the near future, this could turn out to be completely overkill. This could be underkill. We don't know yet. So that's really what I want to preface this all with, is that this is what we believe to be right now to protect our providers and our patients, but it could turn out to be completely inaccurate. So our response to coronavirus actually begins at dispatch. We have emergency medical dispatchers that are specifically trained to ask screening questions of patients prior to dispatching emergency units. Those questions include things like, do you have a fever, a cough, respiratory illness? Have you been in contact with anybody with coronavirus, suspected or confirmed? With that, they are able to relay to us what the risk is of coronavirus on that scene. If the scene is a high likelihood of a coronavirus or a severely infectious disease process, they dispatch it as a 5-alpha call, and that cues everybody on the engine and the ambulance responding to that medical call that this could be a dangerous scene, and we do alter our response slightly. So on 5-alpha calls, we arrive on scene, the engine stages, and one paramedic gets geared up in a gown, goggles, N95 mask, and gloves, and enters the scene alone. Now, if it is a confirmed cardiac arrest or something that sounds immediately life-threatening, we do send more in, but sending one person in is meant to limit exposure and preserve PPE because we don't have a lot of N95s and gowns to go around. The shortage affects us just as much as it does the public. As the paramedic goes in to assess that patient, the fire department and the EMT on scene will begin taping the ambulance. So they actually take a plastic wrap and they start taping it up, and they just wall off the cabinet side of the ambulance so that if the patient is coughing, there's droplets in the air, it's not getting into the cabinets that we have all our supplies in, which we have to use for other patients later that day. So this is just a precaution. It's not the same thing as the Ebola taping we were doing for a while, where the entire ambulance was hermetically sealed and it was this crazy procedure. This is literally just taking some of that dextrometer wrap and duct taping it to the ceiling of the ambulance, wrapping it in. And it just keeps the gross contaminants off of everything else. It also walls off the driver compartment so that the driver going into the hospital doesn't have to sit in full PPE and they're protected from that patient. Now, through this time, we are not taking any student riders. We're trying to limit the number of third riders we have on our ambulances, and we're just trying to cut down on the amount of exposure. Now, while all of this is going on, our dispatch is also dispatching a specialty decon team which meets the ambulance at the hospital, and I'll go through that procedure in a little bit. So once the patient has been brought out to the ambulance, we do not do any crazy procedures in the back of the ambulance with the doors closed. If the patient needs respiratory treatment, CPAP, BiPAP, nebulizer treatments, anything that could potentially aerosolize this disease, we keep the doors of the ambulance open while we're doing the treatment, and we try not to do those treatments while transporting into the hospital. That being said, patient care always takes a front seat, so if the patient does need it, we will initiate those treatments. These are just things that we try to do in most cases. Once the patient arrives at the hospital, the provider in the front seat of the ambulance puts on a new pair of PPE, and a representative from the hospital meets us out in the ambulance bay. As this happens, we start taking the patient out of the ambulance. Both providers will help go into the ER and take the patient to hopefully an isolation room, but we can also use rooms with the door closed. Isolation rooms simply have negative pressure so that you don't have that particulate getting out into the hallway quite as readily, but the CDC has said a closed room is adequate for these patients. The patient is transitioned over, and then that decon team that I told you about earlier meets that crew, and they start a gross decontamination of the ambulance. So the decon team has capper units on, which are just a positive airflow device that takes the place of your N95s and masks. they're also not disposable so that they can be cleaned and reused, which is why we're using them in this situation exclusively. With that, they take the plastic down, they wipe down the cot, every surface that somebody might have touched, including door handles, latches, seats. And then we take a little disinfecting gun and we go over the entire ambulance with a specialty disinfectant. And that just ensures that we've hit every single surface. We hit the cabinets, we hit everything that was behind the plastic, the floor, and then we get whatever providers had on them. So we'll disinfect their boots and they will doff their PPE. As that's done, that crew can get back in service, get back out onto the street, and then we, as the disinfecting team, we disinfect each other. So you just go through and make sure that that PPE is clean. You reset everything and we take everything back to the station, charge it, and get it ready to go for the next call. Right now, our service is running between 5 and 20 of these decons in a 24-hour period, which is very quickly overwhelming our resources. We're trying to figure out different ways to respond to this because I believe in some of these instances we are over-responding. But for us, it is of the utmost importance to protect our staff members. If we start getting sick, then we have nobody to staff ambulances, and we could potentially be spreading this disease to our at-risk patients if we don't know we're infected. One of the important things to remember about the coronavirus is that you are infectious even if you are not showing symptoms yet. So you have a period of time where you can be spreading it to others and not have a single symptom yourself, which is why it's so important for healthcare providers to protect themselves at all costs, because if you give this disease to that elderly person with a history of COPD or CHF, you are essentially giving them a death sentence. So we want to make sure that we are being safe and protecting all of those we serve. For the lay public, I would really urge you guys to stay home, avoid crowded places, don't go out for all these social events in areas where there are a lot of people. This is not out of fear. You know, honestly, most of the people watching this video could get the coronavirus tomorrow and be completely fine. You know, they would have a cold for a couple days, feel miserable, recover, and everything would be peachy. It's really not the young populace that's a problem here. The issue is when you spread that to the elderly patient or the people with all of these comorbidities, like asthma, COPD, cancer, immune deficiencies, because those patients can die from the coronavirus, and that's a lot more serious, which is why travel, any of these crowded places, are things to avoid at this point in time. That being said, don't give in to the panic, this fear, you know, this whole, you know, buying all the toilet paper and stuff. You know, we've done that to ourselves. So a couple people went and thought toilet paper was what they had to stock up on. The media reported it, and then everybody else saw that and thought, well, there's going to be a shortage of toilet paper. I better get some on board with this and get some in my own stash. And now we have no toilet paper. Same with disinfecting wipes and all of this other stuff. Go about your day. Get the supplies you need, but you do not need to hoard supplies for yourself. You know, there are a lot of other people that need these things, so please make sure there's stuff available for others. Make do with what you have. And you know what, to be completely honest, this might be a great time for the US to transition to bidets, because honestly, they're just way better, and the rest of the world gets it, and we still have to figure that out. Guys, I really want to thank all the healthcare workers that are watching this video. You know, right now, this is a very hard time for EMS and healthcare workers. We are getting overwhelmed. A lot of people are functioning on very little sleep, mandated overtime, all this stuff. So, you know, this is really awesome to see this community and how dedicated we are. But, you know, I know it's difficult and we're getting through it. So thank you for doing what you do, and I will see you next week.